Imagine being handed a super complex map, getting dropped right in the middle of a massive maze, and someone just saying, hey, figure it out. Honestly, navigating women's healthcare, especially when you're dealing with pelvic discomfort, can feel exactly like that. You know something just isn't right, but finding the exact right person to help you fix it, it's like a giant puzzle. Well, welcome to this explainer. Today we're going to decode that map and give you some crystal clear direction. Think about it. You're dealing with pelvic pain, maybe some totally unexpected leakage, or that lingering postpartum discomfort. Your immediate thought is probably, okay, who exactly am I supposed to call first? Do you wait weeks, or let's be real, even months to see a gynecologist? Or is there another path? Maybe you've even been handed generic painkillers in the past when what you really needed was targeted muscle therapy. It is incredibly frustrating trying to figure out the right starting point for your specific symptoms. If you've been bouncing between endless Google searches and waiting rooms, trust me, your frustration is completely valid. But don't worry, we're untangling this whole web today. Here's our agenda. Navigating your pelvic health, the physiotherapist's role, the gynecologist's role, where their care overlaps, why you should start with physiotherapy, and finally taking your first step. Let's jump right in. Number 1, navigating your pelvic health and finding clarity. Knowing exactly which healthcare professional to see for different aspects of women's health, that is a real game changer. It saves you time, it saves you money, and most importantly, it gets you relief so much faster. Our source material for this explainer comes directly from the experts at Ova Women's Health. They're a specialized clinic dedicated entirely to this field, and they've seen firsthand just how confusing this journey can be. By establishing a safe, highly specialized space, they've really created a trusted starting point for anyone out there seeking relief from pelvic issues. Number 2, the physiotherapist's role, treating the foundation. Notice how the focus here is purely on the physical structure. A pelvic floor physiotherapist is a specialist strictly focused on treating the muscles, ligaments, nerves, and soft tissues that support your pelvic organs. Think of your pelvis like a house, okay? The physiotherapist is basically the contractor, making sure the foundation, the floorboards, and the structural supports are strong, flexible, and functioning perfectly. Because if that foundation has dysfunction, well, it impacts absolutely everything. Your bladder, your bowels, your sexual health, the whole shebang. So the crucial point is knowing what actually falls into their tool belt. Physiotherapists treat conditions like vaginismus, which are involuntary muscle spasms, or vulvodynia, which is chronic pain at the vaginal opening. They also tackle urinary incontinence and pelvic organ prolapse. That's when organs literally drop from their normal position. And they are absolutely vital for postpartum recovery, helping you restore abdominal muscle function and rehabilitate perineal scars. Oh, and here's a totally surprising fact for you. They even treat clogged milk ducts using specialized ultrasound treatments. No way, right? But for any of these muscle, nerve, or soft tissue-related issues, physiotherapy is very often the first-line, life-changing approach you need. Section 3. The gynecologist's role, medical and hormonal care. Now, if the physiotherapist handles the structural foundation, what exactly does the gynecologist do? Well, a gynecologist is a medical doctor. Their primary focus is on diagnosing, treating, preventing, and performing surgery for conditions related specifically to the female reproductive system. Their training covers a completely different spectrum. We're talking obstetrics, complex hormonal imbalances, and necessary surgical procedures. You should absolutely be seeing a gynecologist for things like your annual pelvic exams and pap smears. They're the experts to consult for menstrual disorders, polycystic ovary syndrome or PCOS, which causes intense hormonal imbalances, cancer screenings, fertility issues, and managing those really tough symptoms of menopause. Basically, if there's a suspected infection, abnormal bleeding, or a need for a medical prescription or surgery, the gynecologist is your definitive go-to. When you look at this fork in the road side by side, it really becomes so much simpler. On the left, we've got the physiotherapist dealing with muscles, nerves, and soft tissue function. On the right, the gynecologist handling medical, hormonal, and surgical interventions. Keeping this simple comparison in your back pocket is going to save you so much confusion down the line. Section 4, where care overlaps. The gray area. Of course, the human body isn't just perfectly categorized into left and right boxes, is it? There's a gray area. A lot of symptoms fall into a shared scope of practice where both of these incredible specialists are actually needed. Let's look at this cheat sheet. Take a symptom like pelvic pain. A gynecologist will investigate medical causes like endometriosis, while a physiotherapist focuses on the muscle tension that's contributing to that pain. For postpartum care, the gyno monitors your overall reproductive recovery, but the physio, they're the ones helping you physically restore your pelvic floor strength. With incontinence, a gyno might offer a medical intervention,
while a physio offers a conservative muscle strengthening alternative. Both professionals tackle these conditions, but from completely different, beautifully complementary angles. So how do you decide what to do today? Well, here's a highly actionable rule of thumb straight from the experts. If your symptoms involve pain, leakage, difficulty relaxing, constipation, or a feeling of heaviness, start with a pelvic floor physiotherapist. But if your symptoms involve abnormal bleeding, major hormonal changes, infertility, or suspected infections, book an appointment with a gynecologist. Number 5. Why start with physiotherapy? The strategic advantage. For those overlapping symptoms we just talked about, the pain, the postpartum issues, the discomfort during intimacy, why do experts actually recommend checking in with a physio first? First off, faster access to care. You generally don't have to wait months to see a physio. Second, no referral is required. Because pelvic floor physiotherapy is considered primary care, you can just book directly. Third, you get a comprehensive assessment of the muscles and nerves right away, which often entirely resolves the symptoms without ever needing medication or surgery. Plus, it's frequently covered by extended health insurance plans, which is a huge bonus. As the source material from OVA Women's Health points out, pelvic floor physiotherapists can identify and treat muscle-related causes quickly. If the issue is medical or hormonal, they will direct you to a gynecologist. See, this is a profoundly collaborative approach to your care. Starting with Physio acts as this brilliant triage system. It ensures you get immediate help and, most importantly, you're guided correctly if deeper medical issues do arise. Let's map out that ideal, completely stress-free patient journey. Step 1. You bypass the waiting game and book a physiotherapist directly. Step 2. You work with them to treat and resolve any muscular root causes of your discomfort. Step 3. If anything lingers that points to a hormonal or surgical need, your physio seamlessly refers you to a gynecologist. By doing it this way, you are empowering yourself to take immediate control of your health. Finally, number 6. Taking your first step on your healing journey. The absolute most important takeaway from this explainer is that you deserve to feel better. You don't have to just live with it, and specialist help is completely accessible to you right now. If you're looking for that trusted starting point, OVA Women's Health, located in Burnaby, British Columbia, is a premier, incredibly compassionate clinic ready to help. They provide a holistic approach to exactly the issues we've discussed today. They even offer virtual sessions so you can get care right from your living room, and they have emergency appointments specifically for things like incredibly painful clogged milk ducts, providing immediate relief when you need it most. They've intentionally designed their first consultations to be unhurried, highly confidential, and deeply validating. If you are ready to stop guessing and start healing, scanning the QR code right now will let you book your appointment. It's literally one simple action to kickstart your recovery. We've cleared away the confusion. You now hold the map to navigate your pelvic health with absolute confidence. The only question left is, are you ready to prioritize yourself, stop putting your comfort on hold, and take that crucial first step today? Because specialist help exists, and honestly, you've been patient long enough.